you are watching TV9 News. I am Amrutha. Let me begin by asking how many of you are fully vaccinated today? And by fully vaccinated, I mean that it's been more than 2 weeks, at least, since your second dose of a COVID-19 vaccine. Do you feel invincible against COVID-19 now? Well, it's better, however, if you do not get complacent with COVID-19. Though COVID-19 vaccines are not expected to prevent infection, they are expected to reduce the risk of hospitalization and death due to COVID-19. However, there have been reports, albeit quite rare, let me emphasize that, of fully vaccinated people succumbing to COVID-19. Since vaccines are the only ray of hope of putting an end to this pandemic and returning to our normal lives, let us understand why such rare cases occur and which group of people are more likely to be at risk of COVID-19 death despite vaccination. Dr. Sitesh Roy, an immunologist based in Mumbai, explains to us why some fully vaccinated people may succumb to COVID-19.
Recently, the Illinois Department of Public Health released data on lakhs of doses that were given to their patients, almost 90 plus lakh individuals who were vaccinated. And it was estimated that 1 out of 1,300 or 0.06% was the risk of a fatal response or a fatal COVID infection rather that was seen. When they analyzed these people, they found that people who were above the age of 50 and especially those above the age of 70 made up most of these cases who had a fatal reaction. And there were certain features or health conditions, including comorbidities that these individuals had that made them at higher risk for developing a fatal COVID infection even after receiving vaccination.
While investigation into such cases are underway worldwide to determine the exact causes and the group of people who are more likely to remain at risk of death due to COVID despite vaccinations, here is what the initial observations say.
The groups at maximum risk of having a severe or a fatal infection from COVID after vaccination happen to be individuals who are the most immunocompromised. Now, there are several things that lead to immunocompromised states, such as someone who is having cancer, someone who's undergoing cancer, chemotherapy, radiation therapy, someone who has especially blood-related cancers, leukemia, lymphoma, people who have severe hypertension, diabetes, heart disease, who've had old cardiac surgeries or problems. People with the maximum comorbidities are the ones who are at greatest risk even after full and appropriate vaccination. If they were to come down with a COVID-19 infection, they can still have a severe or even sometimes a fatal course to their disease.
Finally, what are you supposed to do in case you or your loved one contracts severe COVID-19 despite being fully vaccinated?
I think we all have to be humble in front of this virus, and even if we have taken the vaccination and some mutant variant happens to get to us and cause an infection, we have to be quick to get medical help, get the right evaluation from a trained and proper physician, and make sure that we get all the necessary blood biomarkers, the RT-PCR test, identify our disease and severity with the necessary investigations, and seek medical help at the earliest. I believe anyone with mild, moderate or severe COVID should not try to just take care of themselves on their own. They should get valid and healthy medical advice and follow what is most appropriate for their earliest and best recovery.
In the US, only 77 out of over 87 million people who were vaccinated till 20th of April died due to COVID-19. While no vaccine ensures 100% protection, it does lower the chances of hospitalization and death by at least 10 times. Hence, the underlying message is that even fully vaccinated people need to follow COVID safety protocol of masking up, avoiding crowded spaces and sanitizing regularly. Let us know what you think in the comment section down below. Also like, share and subscribe to TV9 News. Thank you for watching.